Hello again, I'm Lauren Diapoli. Welcome to Module 4, Social Cognitive Theory and Social Ecological Model. In this module, we will be exploring the social cognitive theory, which presents similar ideas regarding the stages of behavior change that we've discussed in the last module, and we will also assess conditions that influence behavior through the scope of the social ecological model, and then I'm going to quickly discuss the assignments that you will complete after you watch this lecture and you complete the module's readings. We briefly explored how to engage with patients in some forms of assessment. Well, the social cognitive theory is another, and it was proposed by Bandura to analyze and understand the thoughts and motivations that drive a human towards action. This theory suggests that individuals have a dynamic relationship with influential constructs, similarly to the trans-theoretical model of behavior change that I discussed in the last module. Self-efficacy is the driving force to behavioral intention. In social cognitive theory, the outcome expectations are the potential mediators of change and the expectations a patient perceives from the outcome of engaging in a behavioral change. These will promote a patient's self-efficacy and encourage the development of goal intention. Even though self-efficacy is an internal and personal feeling and an emotion that's associated with the person's ability to perform a task, there are methods that we can take towards enhancing our patient's self-efficacy. Mastery experience is enabling the individual to experience, master, and explore desired behaviors that increase their confidence and ability to take action. So this can include showing a patient how to check their blood sugar and then allowing them to practice it in front of you. Another example might be suggesting they watch a specific YouTube video of someone cooking a healthy meal and then encouraging them to follow along so that they can master the experience as well. There may be a public library that offers free classes where community members can learn to cook or take exercise classes. Programs like this allow the person to master a new skill while also utilizing a social model. Watching demonstrations, joining a support group, or engaging with individuals who have developed the ability to perform the steps that the patient needs in order to follow through with behavior change is a wonderful way that they can learn new coping mechanisms and develop new skills. You might be able to provide patients with a schedule for affordable adult education classes, maybe at the local high school. Sometimes they offer cooking classes, yoga classes, and a variety of other skills that can help support your patients in healthy habit adoption. Improving physical and emotional states requires us as healthcare professionals to structure the patient's situation so that they can succeed. We should be sure that the patient is not exhausted or stressed out before attempting to teach them or give them any new direction into new behaviors. I'm sure that you've been in a situation where it took you a little bit of time to process new information. This is an example of how we can change the situation and help the emotional state of our patients. If you've given someone a diagnosis that makes them express anxiety or fear about their condition, you may suggest that they come back with a friend or family member, and that way they can listen to the instructions and new information collectively with someone else before just bombarding them with all kinds of information when they're in the middle of this turmoil. Another way that we can improve the emotional state is verbal persuasion. We can encourage our patients with assurance that they are capable of following through with new behaviors. We can use all of the empathy and understanding that we've already discussed in prior modules, and we want to verbally highlight the individual's strengths and abilities. As we've been discussing through this module, each individual is completely unique. So they have a variety of variables, factors, and constructs which contribute to their stage of change. Just quickly, I just want to discuss the social cognitive variables, which are the patient's perceived support that they have, their understanding of how changes will improve their condition, their perceived outcome, and their ability to self-regulate. So our hypothetical patient is past ambivalence. They have intention and plan to set their goals They've increased their self-efficacy by moving through processes of change. They've seeked out new information. They've expressed positive outcome expectations, and they begin to utilize social support and self-instruction in commitment to change. But unfortunately, sometimes environmental factors can impede change. Socio-structural impacts could be a lack of available resources, junk food that's always made available to them in their workplace, having no safe place to exercise, if they live in a bad neighborhood maybe, whatever other barriers that they may face that are beyond their specific control. This makes effective goal setting so important. Individuals should have personalized goals according to their own needs and the constructs that are standing in the way of their behavior change. So this brings us to the socio-ecological model. This is where we're going to assess our patients from a holistic perspective, looking at all the psychosocial factors that contribute to their individuality. On the individual level of this model are the beliefs, attitudes, and emotions that we've been discussing prior. This could be things also like their education level, their current knowledge about nutrition and health, and also their personal empowerment and self-efficacy. On the interpersonal level of the social ecological model or socio-ecological model, a determining factor could be what kind of support the person has. Their significant other might not want to make a change in their diet and doesn't feel comfortable having different foods for dinner. This could be a big barrier and could prevent them from having healthier options at home. This may mean that the patient has grown up with role models that showed them poor eating habits. This creates social norms that the patient is now comfortable with. For many families, cooking or baking is just a normal part of their cultural traditions, and this can make making a change more difficult. It's tough to be the black sheep at a holiday who wants the meals cooked differently. So we're going to assess collectively with our patient how interpersonal constructs are going to affect or impede their ability to change. Settings are all of the places where an individual will go on a day-to-day basis. As I mentioned earlier, sometimes there are junk foods available in the workplace. Every day, this person might be tempted with options. Another barrier on this level of the socio-ecological model could be low access to foods, possibly living in a food desert, having limited access to healthcare facilities. All of these things can contribute to the person's previous behaviors and inability to adopt new behaviors. This could also be policies, rules, or informal structures that they engage in. Weekly church might have a very high sugar breakfast each week. Learning that these factors have contributed to poor past dietary habits or behaviors helps us understand what coping mechanisms or skill building a patient might need to move forward. The outer ring here represents the macro level impact that has affected the individual. This could be things they've heard from the media, advertisements they're exposed to, lack of health care because they don't have insurance, any other policies that have affected them. Okay, so now that we've talked about all these determinants that have affected patients' perceptions, their conditions, and their behaviors, as we move forward, we're only going to assess how we address, affect, and implement our patients positively towards a process of change. On an individual level, we're going to revert back to those self-efficacy enhancing methods and any education, information, or support that we might be able to provide the patient with that shows we have an understanding of their conditions and help them build in their knowledge and abilities to move forward. Encouraging our patients to build up their social support by getting their family or friends involved helps them in their change process. If a man presents with high blood pressure, but his wife cooks for him every night, it's important to provide the information that's necessary for behavior change to both of those individuals. Making decisions when grocery shopping and cooking, as well as family eating patterns, are huge determining factors in dietary behaviors. So we want to encourage strategies that promote supportive environments by including family, friends, or any kind of social support in our interventions. Of course, some of the institutional, community, and policy factors that pose as barriers to our patients are beyond our control, but there are ways for us to increase accessibility and provide opportunities to circumvent negative conditions. If a patient lives in a bad neighborhood and can't afford to go to the gym, we can suggest methods of exercising in the home, using videos available online or on TV, getting affordable workout equipment that they might be able to use, and encouraging ways that they can engage in those activities. We might also suggest affordable grocery stores that we know nearby. We can offer information about local food banks, applications that give people coupons and discounts for healthy foods. This could even include providing our patient with any tools or tips for avoiding temptation, like keeping healthy snacks available at work to avoid eating the junk food that's available, or maybe taking an alternative route home when they drive to avoid a trigger, like a candy shop or donut store that seems to catch their eye on the way home. We are able to help them navigate their food environment in compassionate, understanding ways. As leaders of health and wellness in our community, we should commit to being a part of policies and systems which protect, help, and serve the needs of our communities and society as a whole. This is where collective efficacy, not collective self-efficacy, comes into play. Building awarenesses to increase fruit and vegetable consumption through social marketing campaigns is just one example of ways that we might make a macro level impact on the health status of people. As active participants in the healthcare system, we can promote standards which help to structure educational materials that improves patient knowledge. And in terms of individualized care, we can increase knowledge about available resources. For example, Women, Infants, and Children, which is the WIC program, or Supplemental Nutrition Assistance Program benefits, which is SNAP. These are federal food and nutrition services that were put in place to help underserved populations. That might be appropriate for some of your patients. This is a screenshot here of the USDA's website, which has a variety of resources that you can share with your patients when appropriate. Just in the screenshot alone, there's a little graphic about the dietary guidelines for Americans. That might be a helpful resource. There's also ways to apply for SNAP and for WIC and other educational materials that might benefit them. So by assessing patients' psychosocial readiness and self-efficacy, we can implement and design effective intervention approaches. Through an exploration of the socio-ecological constructs, we can help to provide multiple levels of patient support. After you review this module and you read through the content provided, you will be completing a resources presentation, which is going to allow you to show your ability to address an individual at different levels of their needs. You're also going to be filling out a summary table. This is going to give you the chance to explain in your own words the constructs of each of the modules and theories that we've discussed so far. In complete sentences, you're going to explain how you would appropriately utilize the theory or model in patient care. Feel free to use examples from the readings and even materials that you have obtained for your resources presentation to discuss how to implement interventions according to the behavior change theories and models. Thank you so much for watching, and as always, reach out to me with any questions regarding this module's content or the assignments or any questions you may have at all. Thank you so much. Here are my references. Take care.